Good morning, everyone, and welcome to the June Advocacy webinar. Tony, do you want to take it away?
Absolutely. Thank you so much, Derek. Good morning. It is a beautiful Tuesday morning here in Columbus, Ohio, and we're going to go straight into our State House update, if I can figure out the technology. All right. Derek can figure that out. Thank you. We have been talking for almost a year now on powdered alcohol. That was actually approved at the federal level, and it would be for sale in some states. However, we can now count Ohio as a state it will not be legal in. House Bill 14, which was the powdered alcohol bill, was being held up in the Senate by a couple of senators, mainly Bill Seitz from Cincinnati, who didn't want to turn Ohio into a nanny state, and even was quoted as saying that he thought it would be nice to have if you're on a hiking trip, that you didn't have to carry alcohol. You could just carry one of these packets, pour it into a bottle of water, and you'd be good to go. I don't know if hiking and alcohol use mix, especially if you're out west on some of those really big cliffs, but who am I? So what happened was Representative Beakey and the House folks decided to, as Senate Bill 7 was going through the House, which would ban pure caffeine products. There was a young man who passed away because he ate pure caffeine and had some kind of health issue and passed away. They decided to attach the powdered alcohol bill as an amendment to Senate Bill 7. They contacted the Senate, and the Senate said, you send it back over to us, we'll pass it, everything will be good to go. So it didn't have to go through committee or anything else. So with that, 2 weeks ago, Senate Bill 7 was passed by the House, sent back to the Senate. The Senate passed it with the amendment last week and is now headed to the governor's desk for signature. So I want to thank everyone for their hard work, for writing letters, for taking this issue on, because you have been a success. I mean, this is only because of the partners we have out there that are explaining this to the members of their community, to community leadership. So really take a bow this morning because I think we have really kept a potentially dangerous product outside of the state before it could even get started, especially for young people. So thank you, thank you, thank you. And again, Senate Bill 7 is the vehicle for that and should be signed by the governor in the next 10 days, I think he has. Another bill that was just introduced is House Bill 230, which is titled Chemical Dependency. But what it does is it actually changes some language in regards to prevention services. First, one of the bigger changes is instead of an OCPS-A, OCPS-1, and OCPS-2, we will have the OCPS-A. I'm sorry, what is that? Is it an A? Okay. Thank God I have people around me. I'm not talking to myself. We'll still have the OCPS, which is the Ohio Certified Prevention Specialist, but the OCPS-2 will change to what's called an OCPS consultant, which would you'd have the same number of hours and those types of things for the 2. But it would just be a name change to you'd be a consultant instead of the 1 and 2 system. The other things in the bill that are just for your own notation is any reference to alcohol and other drug in prevention has been removed from language about prevention services. So this is something that to broaden our scope as we include gambling, as we include some more behavioral health issues. We are not really put into a box of just alcohol and drug, but we can expand our focus and our expertise into other areas. So that is something that is that's new, and also actually the the definition of prevention services is something else that has changed. And that goes, the old language read that alcohol and other drug prevention services means a planned process of strategies and activities designed to preclude the onset of the use of alcohol and other drugs, so on and so forth. The new language about what prevention is in the state of Ohio is listed below. Prevention services means a comprehensive, multi-system set of individual and environmental approaches that maximizes physical health, promotes safety, and precludes the onset of behavioral health disorders. As you can see there, the inclusion of just being alcohol and drug. Alcohol and drug is implied in the new language, but it is specifically taken out of the language according to House Bill 30. It has not had a hearing yet, but from what I'm hearing, should be somewhat of an easy change in the House and the Senate. So I'm guessing that in a few, actually, well, maybe longer than that, maybe in the fall sometime, that this will actually become law. And this does bring up the point that everything right now is about the budget. So these bills, they're being heard, they're being debated, but the real focus of both the House and the Senate is to get this bill passed. By law, the House and the Senate have to have a bill given to the governor, and the governor has to sign it by June 30th, so we can start the state fiscal year. So this is something that has really taken some precedence. Yesterday, the Senate announced some changes in their version of the budget bill, and that they said that they would have all of their LSC, the Legislative Service Commission, is drafting that bill, the budget bill, right now, the way that the Senate would want it, and it is it should be they would like it sent back over to the House by June 19th. After that, there would be some issues with what's called a conference committee, where 3 people from the House and 3 people from the Senate would get together and hash out the differences and come up with a comprehensive bill that that hopefully would include some language from both, and then it would be given to the governor by, I'm guessing, June 27th, and then he would do some line item vetoes, sign it by June 30th, and that's that. So moving on, we have some other, thank you, we have some other bills down at the State House. There seems to be an awful lot of talk about Good Samaritan laws. We have one bill that takes into account alcohol, underage drinking into Good Samaritan laws, and another, that's House Bill 201. And House Bill 249 was actually just introduced, and they talk about drug overdoses and opiate issues. What are Good Samaritan laws? Good Samaritan laws are if you are a person who might, in the case of House Bill 201, if you and a friend are both underage and you're drinking, and the friend has some kind of medical emergency, that the person who is with them, if they make a call to the EMTs or whoever else to save this person's life, then they would not be instigated in any kind of criminal process for underage drinking. So basically, it's if you're there, make the call, and you won't get punished for it. House Bill 249 is the same type of concept, where it's if you're with someone, you're maybe doing heroin or some other kind of opiate type of drug, prescription pills, and if the person goes into an overdose state, then if you're with them, you would not be criminally charged with using drugs by making that call. What has been found, a couple of years ago, Representative Sprague did a task force that went around the state, and one of the things that they found was that individuals would leave if someone started to go into overdose. Because of fear, individuals would leave the person in an overdose state, and that person would die. Happened to I know of one person down in Portsmouth, Ohio, Scioto County, and a couple of other places. So these are bills to basically, they're not prevention. They're prevention of death is what they're calling it, but it's something I thought that as conversation is started on these types of laws, it might be something that your coalition or your organization might want to look at and either come up with some kind of support or a policy against, or however you want to do it. We have actually testified in favor of House Bill 201, just because if there is a young person who could possibly lose his or her life, we do not want someone to be under criminal prosecution for making that call and saving that person's life. So it's kind of it's a difficult issue sometimes for folks, but something that we hope could save lives. Some other opiate issues that are out there and bills that they're hoping to introduce. One is to require insurers, both private and public insurers, to pay for hard-to-crush narcotic painkillers. We have crush-proof technology. However, insurers will not pay for that because it's more expensive. These pills are more expensive. So what they do is they actually in their formulary have to prescribe the pills that you can crush and use in ways that it's not intended for. And this bill that they're hoping to introduce would require insurance to pay for those crush-proof medications. Another issue that folks may introduce down at the State House, they want to change Medicaid rules to require docs to show a medical necessity to prescribe narcotic opiates above and beyond whatever the prescribing guidelines are. So if you have someone who goes in for a toothache, it would basically not allow them to prescribe a 60-day supply and those types of things. So unless you can give a medical necessity, and they would have to state that. So those are some other issues going on down at the State House that I thought you might be interested in. The marijuana update, that seems to be heating up, and will get just even bigger as the summer and fall wears on, as we plow toward to Election Day. Responsible Ohio, they have about 500,000 signatures, they claim, and they only need 305,000. They want to get 700,000, so as signatures are verified, they will have the 305,000 necessary. So they have 500,000 signatures. We know that in our debates and in our talking, in our different ways that we work against these folks, they're really pushing the medical piece. Even though medical, there's only one paragraph in the entire 11-page document, a very small paragraph, they understand that medical is the piece that people are most likely to vote for. So they're really avoiding the monopoly language. They're avoiding investors. They're avoiding money, which is really what this is all about. And they're really pushing the medical piece. So it's time, if you're talking about this, make sure that you talk about medical marijuana, because that seems to be something that they're going to push. That seems to be also what their ad blitz is going to be about. In August, starting in August, they should have about a $7.5 million advertising blitz in August, September, and October leading up to the election. These are a lot of commercials and a lot of different things through social media. So this is why we need every community to talk about marijuana. You being the expert in your community is a great opportunity to talk about the issues surrounding marijuana legalization. As you as a 501c3 right now, since the signatures are not verified, you can talk about Responsible Ohio. It's just a concept at this point. However, once the signatures are verified in August, then you have to go more into the marijuana education mode. And just talk, you could talk about legalization, you can talk about what's going on in Colorado, you can talk about what's going on in Washington. You just can't mention what's going on Responsible Ohio's language. That's after August. Right now you can do that. They actually did try, they're trying, and this is why I think, quite frankly, I think they're desperate. We're hearing that the investors are not happy because this has been such a poorly run campaign. There was a great article today in the Youngstown Vindicator against Responsible Ohio. There's been other, the Columbus Dispatch has done some very, very harsh editorials about Responsible Ohio's true concepts instead of what they are claiming to be. So there's an awful lot of pushback from the public. Quite frankly, this is not going as well as they thought it would, including the fact that again we have many pro pot legalizers calling us, the Drug Free Action Alliance, how can we help you defeat this? Because this is not good policy. This is not something that even they want because it's such a limit, and they realize that it's just 10 people making money off of controlling the marijuana industry. Responsible Ohio did include some new language, not included in Responsible Ohio's amendment, but they want to get some language approved that would expunge all records of marijuana offenders. Again, if you go to the Youngstown Vindicator today, they've got a great article on this about expungement and why that is a bad idea as well. So they're kind of grasping at straws right now, trying to get as much support. Does this mean that I think we're going to win? I don't know. I think everything's still up in the air. I think it is. We have a lot of hard work to do. Do I think we can win? Absolutely, I think we can win. I think this is something that is not only winnable, I think it is something that is needed in the nationwide conversation about marijuana, that not even $40 million can buy this because of public health concerns. We need to be those public health officials. We need to be those public health experts out there and expose this for what it really is. And quite frankly, you have a lot of interesting and strange bedfellows who can support you in that. They're also, Responsible Ohio is having this Thursday a marijuana legalization law symposium at the Moritz College of Law at the Ohio State University. Basically, they have Hamilton County Prosecutor Joe Dieters. They have Professor Beckham from Ohio State that does marijuana policy at the university. And I do have to tell you that we have been, Professor Berman did give us the insight that he is a paid consultant by Responsible Ohio. This is going to be a pro-legalization symposium, 10:30 to 3:30. So as this gets released, you might want to come up with some talking points, mainly about law, maybe about public safety, those types of places. Good places to go with the fact sheets that we introduced last month, and also the Rocky Mountain HIDTA report at rmhidta.org. Those are two good pieces that could help you with some of your talking points. And what's interesting is Marcy Seidel, our executive director, debated Ian up at the Cleveland Free Health Clinic in Cleveland, Ohio, where it was an open event to anybody. And we actually fought them on this, on allowing this question, but they did it anyway. they had a question after the end of this hour and 15-minute debate on whether individuals who listened to both sides were more inclined or less inclined to vote for legalization. And what was really something that I think is just should be a boon, put some gas in our engines, is that more people, after hearing both sides, were less inclined to vote for legalization after this debate. This is, as long as people are given the truth, and even given the, this is not about sick grandma and grandpa. This is not about people being in jail or any of those other things. This is about 10 individuals making money and opening up an entire market, which is going to hurt our kids, it's going to hurt our business, it's going to hurt public safety, and it's going to hurt public health. After hearing that, they tend to come to our side. This was not a room full of preventionists or anything else. These were general population folks, and they, the truth shall set you free, and it certainly did in this debate that was done up in Cleveland. You have the truth on your side, and as long as we keep proclaiming that in our communities, we can certainly win this. The next piece is, along with marijuana, is Auditor Dave Yost and Representative Mike Curtin. Dave Yost is a Republican, Mike Curtin's a Democrat. Have both come out publicly against monopolies being entered into the Constitution. So Auditor Yost has testified in front of the Constitutional Modernization Committee to introduce language to limit monopolies in the Ohio Constitution through a joint resolution. A joint resolution means that 3/5 of the House and 3/5 of the Senate have to agree that this language needs to be put on the ballot in November, and then people would be allowed to vote on whether monopolies should be in the Ohio Constitution. Now, with this, the issue is the time restraints. Senator Faber and House Speaker Rosenberger have both given their support to this. However, everything has to be done by August 5th. Which is with the budget going on, and that not going to be done until until June 30th, and then you have a summer recess. That really is a tight time frame. So you've got time constraints on whether this is really going to happen or not. Responsible Ohio obviously is not happy with this language because it would absolutely destroy their because basically what it does is, since they're so upset about this basically proves that they know that they're a monopoly. They know that the only way they could win is to go medical, but they are a monopoly, and they want to do this through the Ohio Constitution. So they're basically threatening the legislature with another amendment in 2016, which instead of a year-long legislature, it would limit the legislature that they could only work 3 months out of the year. They would have to take pay cuts, and it would eliminate all of their pensions if you are a public official. So obviously, Responsible Ohio are not gaining any points with the legislature on doing that, and right now it's just a threat. The last piece before we go to questions or anything are we have a couple of tools that I'll be sending out today. I'm just getting them finished up. The Arizona Chamber of Commerce has released a policy brief on the consequences of marijuana legalization. It's not a whole lot of new information. It's kind of new that it is coming from Arizona. The other piece that I think is really fascinating and good from our standpoint is that this policy brief is not from public safety, it's not from law enforcement, it's not from public health. It is from a chamber of commerce, and it's kind of lengthy. I think it's about 9 pages. It's an easy read, but it talks about many different things that are going on and why you should be against legalization. You've got costly social and economic consequences. the overstated economic benefits. You've got black market consumption going up, unintended consequences, including employers and the employer liabilities and those types of things. Also, the edibles they talk about as well. So it really is a great document. Plus, again, this is from a business group. The Arizona Chamber of Commerce has come out opposed to it as well. And then also there's it's a press release from Nationwide Children's Hospital here in Columbus, Ohio, and they did a report about marijuana poisoning of children under the age of 5 years of age. Usually it's to these edibles, and their study shows that marijuana exposure for the children 5 years and younger rose 147% between 2006 and 2013. And what's even more frightening is 75% of those children were under 3 years of age. So these are toddlers, kids barely out of diapers, and they're having to go in and because of health issues by usually eating these marijuana brownies and candies and gummies and things like that. So I'll be sending those out later today, and please use those as far as and wide as you can. The other piece, and I would actually like some feedback on this, is I would like to do a webinar. One of the things I get asked all the time is, how do you answer this question on racial disparity? How do you answer this question on eliminating cartels? How do you, all of this kind of stuff, the more difficult questions. And I'm thinking of doing a webinar on these how to answer difficult questions. I haven't asked, but I would like to get a national presenter to help out with that webinar. Would like to know your thoughts, whether that would be helpful or not, or should I just kind of forget about that or not? So, as you think about it, email me or call and say yes, yay or nay. I don't know. Do we do surveys after this or not? I'll tell you what. We'll send out one survey with, do you think it's a good idea to have a hard to answer marijuana questions webinar? And yes, that was such a great title that I just came up with. We'll send that out as well, and I'll basically go with what y'all think, whether that's valuable to you or not. So didn't know if there are any questions or anything.
Yes, we've got 2 questions and a comment. First of all, several people have said, yes, that would be very helpful. So our informal survey right now says, do it, but come up with a better title. And the first question is from Nicole, and her question is, are the marijuana speaking points that were presented by Amy Wade at the ADAPO conference in formal format?
Not that I know of. I was asked that question today, and I think Amy and ADAPO are finishing those up. They had a session at the ADAPO conference, and we're taking those public opinions and revising things a bit. So those, from my knowledge, those are not out yet, but they should be out very shortly.
Thank you. And if you do have a question, please ask it in the question section of your GoToWebinar navigation panel. The second question, also from Nicole, is we have a coalition in Hamilton County that wants to share marijuana messaging at a parade in July for their community. They will be put on a banner and other giveaways. They need to have a short message that's to the point. Do you have any recommendations?
Not that if there's something in the fact sheets, I can check around the country to see if some other communities have done things. I think you kind of want to stay away from those sticky points of stay out of the weeds and all of that kind of stuff. But I'll check on whether there's something that was done in Florida or even Colorado, and whether those have been impactful or not at getting people's attention and possibly even making someone think about legalization from our standpoint. So I'll get back with you, Nicole. Good question, though.
And this question is from Greg. You'd mentioned the free clinic event. When is that?
That was last week. Oh, I'm sorry. That was last week. That was last Thursday, I think it was. So that was 5 days ago. So it got some news coverage up in Cleveland, and I forget the guy's name who was helping us out with that. But the Cleveland Free Clinic director was the one who actually organized that up in Cleveland, Ohio.
And then this is actually a comment. Last thing that we have for today is Mylan's recommendation is to do the webinar before fair season. So especially the signature gatherers are out collecting, that we'd have appropriate ammunition for them.
Great point, and that if we come to a consensus, I think we'll do that. So and we'll do it quickly in the next couple of weeks. So please know that the fact sheets are available as well, and if you would like to order some, we still have some of those. So please, if your printing budget is running low this type of year, we'd love to help you out. Get those out, hand them out to every, I don't know, I can't say Tom, Dick, and Harry. That's my grandmother's old saying. I don't know if people in Ohio know that. But every individual that you see. So please order those. We have plenty, and would love to get those out to folks to share in their community. So call Emily, and she'd be able to help you out with that.
Okay, we have no other questions at this time, so thank you for joining us for our June edition of the Legislative Advocacy webinar, and we'll look forward to connecting with you next month in our new fiscal year. So happy almost New Year. Hope you all have a wonderful rest of the month, and we'll talk to you again next month. Thanks so much. Bye-bye.